Okay, so now we're going to talk a little bit about the physical exam. We talked about a lot of the history that we need for prenatal care, but now we're going to talk about the physical exam. In the initial visit, we're going to get vital signs, height, and weight. We need a head-to-toe assessment. We need to assess for breast changes. And one of the things we want to assess early on is, are the nipples inverted? Because if that person plans to breastfeed and the nipples are inverted, then we can work with trying to decrease those adhesions so that the breast will evert to make, the nipples will evert to make breastfeeding easier. We want to assess the abdomen. If they're the second trimester or later, fundal height is measured. We measure from the top of the pubic bone all the way up over to the top of the fundus. Typically, that's going to be pretty close after the first trimester. That's going to be pretty close to the weeks in the weeks gestational age. So after around 20 weeks, that's a pretty close to the weeks in gestational age. We want to encourage them to empty their bladder before the pelvic exam, but we usually are going to get a UA at that visit. A pelvic exam is usually done once during pregnancy. It might be done at this first visit, or it may be deferred to a later visit. Lab tests that are done, HIV probably requires permission in most states, but HIV might be done. Hep B, immunity to rubella, a VDRL or RPR for syphilis antibodies, CBC, type and RH, possibly a BMP. We might get some electrolytes. Women of African, Asian, or Middle Eastern descent might be tested for sickle cell or being a carrier of sickle cell. And if there's a family history of cystic fibrosis, then someone might be screened for being a carrier. Urine is done at that visit for UA. We want to look in particular at protein, but also at glucose. A culture is done if it's indicated. So if it looks like that person has a UTI based on UA, then they would get a culture, and a drug screen may be done if indicated. And so in some states that requires permission also. TB testing would be done if they're in a high-risk group or if the geographic area has a high rate of TB. STI testing is typically done at that initial intake visit, or if they defer the pelvic exam to the next visit, then they would do that testing at that time. So lots of lab tests, a little bit of physical exam. In the next section, we're going to talk about which of those things are repeated at future visits.